We have done something in this administration that had not been done before, and it was totally not my doing. And that is, at the very beginning of the administration, like most people who operate in Prince George's County or run for office, the three major issues are education, crime, and economic development, or maybe transportation. That's usually it. That's all people talk about. For the first time, we decided that education and crime could not be dealt with unless you dealt with health care. So convincing 9 members of the council, the legislative body, that for the first time, if you wanted to deal with those issues, you had to deal with the access to affordable health care. We were just lucky enough that we came around at the time that the Affordable Health Care Act was coming in. We also were smart enough to know that the reason that the hospital, Prince George's Hospital, was having the problem it was having is because people without health care were using it as their primary care doctor, rising the cost up. So we decided to change that trend, and as I said, it was not my idea. I was clearly focused on the things that I wanted to do. They were education and crime. It was Betty Francis and her colleagues that came and said, you're not going to solve those problems unless you deal with this one. So here we are today, taking that next step, working with you in the community who have been doing a lot of this job already. But now we get to, as I said, to the DCAOs, we look past the last 4 years, in almost 4 years in the administration, you say, wow, we've done a lot. Yeah, we've done a lot to get to the starting line. That's all we've done. Even with the work that we've done around the Affordable Care Act and getting it up, getting it operated, getting the kinks out, that's just the starting line. That is not getting to solving the problem and having access. This room today, you in here today, are when we actually start the real work. When we actually start rolling up our sleeves and making sure that throughout Prince George's County, we live up to the promise that at least I made, that everyone in this county will have access to affordable health care, quality health care, and that we connect it throughout this great county of ours. It's 500 square miles. Not a single part of it should be without the ability to have affordable health care, access to health care. Because you know why? If we do those things, then I'm willing to guarantee you that a lot of the things that we read about a couple of weeks ago about young people dying in this county, about people who are skipping school and grades dropping, people who are committing crimes, I'm willing to bet you that if we do our job and we provide the type of access to care that people need on the front end, that all those things we think are so important, at least as politicians, education and crime, a lot of those issues will be solved. But it can't be solved unless we do our job. Thank you.